Live Oak Mortality Center. Lacey Oak. Right in the middle of it. Delayed transfer from root grass. Conducted multiple DNA PCR testing for the fungus in this tree. We got positive on multiple samples. You see the top starting to get a little chlorotic, leaf tip burn, small stem branch death. So we're treating macro infusion, product Alamo. This is a therapeutic treatment. It's a really cool looking triad multi-trunk. This is day 2 for the injection. Being that it's sick, the uptake is slower. So 2/3, 75% of the product is taken the first day. Repressurizing now the next morning. Key to successful or very successful therapeutic injections is a labor of love. Most contractors will only leave it pressurized for 1 day and then just pull the tanks. But it begs the question, if the tree's going to take the product in a couple of days and gets all in there, will the rate of success for that therapeutic injection be higher? And we found consistently that that is the case. So then it just boils down to who's willing to work harder to save that tree. You can see the flare of this tree is already pretty much all above grade. We keep our T's pretty close, somewhere in the 3-inch range. Very important to avoid the valleys. You go up a little higher in those areas. If you've got burls, I see from a side view here, the burl on that flare, that will inhibit the tea from actually staying in the tissue because of how the tissue forms, and it won't transfer very well. So following the label on Alamo recommends staying away from those areas, from valleys and from deformed areas such as the burl. There's some symptomatic leaves. Again, the trick on therapeutics, catching it quick after diagnosis, which is pretty easy to do when you've got a one-day turnaround on DNA, PCR, real-time PCR. So it's a beautiful little tree. One of the few outfits in the state of Texas even knows that the white oaks need to be treated, keep them from dying. It's using DNA testing. It's quite unfortunate. I'm trying to change that, educate my peers, educate the Forest Service, municipal arborists, urban foresters. The northern states, they're treating bur oak, swamp white oak, Quercus alba, the white oak itself, chinkapin oaks. They're treating all those up there. Here right now, the Forest Service is saying that they rarely die and they rarely get it, and all this other stuff that is just straight up wrong. So hopefully we'll get a change in that information and protocol and get the white oaks into our Oak Wilt qualification training.